Good morning, Doctor.
Good morning.
I would like to ask you a few questions.
Sure.
What are the innovative and unconventional techniques that you use in your daily practice?
Okay. So again, I practice a little bit of general dentistry as well as a little bit of course, more of implantology. And we are, again, our practice is called Perio family. We are 3 periodontists in the family. But Parna, my wife, handles most of the general dentistry. I do sometimes pitch in with the general dentistry aspect. And off late, you might call it unconventional, some of them might call it very traditional, is the fact that for most posterior restorations nowadays, I have started using resin modified GIC. I have completely gone away from composite resins. Seen a lot of leakages after a few years, teeth going into endo after a few years. So that is something that I have moved away from. And resin modified GIC is an amazing material, also good to the soft tissue. Being a periodontist, I love something that is good to the soft tissue. So even if you leave a little rougher margin, which I would not advise, you would still want to smoothen it up. But it's very kind to the soft tissue and something that the tooth loves as well. And we've seen it stand the test of time. I mean, it's been there for a long time. So again, as I said, probably it's more traditional than unconventional. But that is something that you would want to use. In terms of extractions, again, because I'm an implantologist, I take my own sweet time. Again, the oral surgeons may probably cringe at hearing this, but at least half an hour per tooth to ensure that the buccal bone remains there and helps me in my future implant placements. So something that can be nice and easy to take it slow. And I tell my students and those who come for our courses as well that the first step in learning how to do perio, raise a flap, is learn a good extraction, learn to raise flaps while you're doing an extraction. So that is something that if everyone can master, I think they'll be good at perio as well. So just some of the few things that I do a bit differently, even though I don't practice too much of it. But yeah, that's what I do.
So that's really good. Moving on, what are some of the complications and challenges that implantologists face in today's world?
So a lot of the complications, I would say more than a complication, of course, this entire conference is about complications and you'll be hearing a lot of it. But a lot of the challenges that we face is people trying to give teeth and implants faster than ever before. People come in and they are like, we'll give you teeth in 24 hours, we'll give you teeth in 48 hours, 72 hours. And the time keeps on decreasing. The one thing that we cannot do as dentists is fight nature. I mean, that is one thing where we need to ensure that nature takes its time to heal. So we may be doing everything mechanical, but if the nature does not give its time, then it's going to fail, and that leads to complications. So that is something where I have had my patients come in and say, okay, that doctor has promised me teeth in 72 hours, immediate loading and all of this. I said, we also can do immediate loading, but I would take it on a case-to-case basis. Not every case is supposed to be handled the same way. So that is something that we find challenging to convince patients that implantology takes time. To give you teeth on fixed implants takes time. It is not magic. We have to let the patient's immune system cooperate with us to ensure that we can give them a successful result.
So what are the strategies that you will develop to convince the patient?
Good question. So I've had, of course, what I do is I document most of my cases. So I document my cases. One of the main things that I do is I show them that. I said, okay, this is a case very similar to yours that we handled. And we went through this case and the patient then asks me questions. See, one of the main things that the patient wants, they are not coming to you for implants, they're coming to you for teeth. Okay, when they come to you and they say, I want an implant, they actually mean they want a teeth, or a tooth. So when I tell them that, okay, you know what, this will take time. So their first question is, will I be walking out of the clinic without teeth? So if you can convince them or give them a provisional restoration, either let it be a Maryland bridge or a flipper or a implant supported provisional restoration, they're happy with that. So if you can convince them that way and tell them that, okay, we will place an implant, we will give you a provisional restoration, you will walk out of the clinic with teeth, but we do not call it teeth in an hour or teeth, and it's not a permanent restoration. you need to come back to us within about 3 months, where we can change this to a much more aesthetic looking restoration. So hopefully that is working. Patients do believe in that aspect of it, that we do need to let nature do its work, and then we can take care of the rest.
Yes, sir. Thank you, sir. Also, sir, 5 clinical tips, like your personal tips that you would like to give.
Okay. So this is more from a practice management point of view. My first tip would be always smile when you enter the clinic. So you have patients who are waiting. They want to see a smiling person. They don't want to see somebody grumpy. Second tip would be to always be on time. Respect your patient's time. Respect your own time. And as I grow further into practice, I've realized that time is of essence. I mean, you would want to do what you'd like, and that would be my third tip, that spend your time in doing things that you like and not something that you have been forced to do. So a lot of times I see dentists are frustrated saying, oh, there are no patients, this and that. I said, use that time to educate yourself and use that time to hone your skills, and make sure that that portrays into your clinic as well. So your team should also be the same, that share the same vision with you when you're doing that. My fourth tip would be in terms of the clinical practice, ensure that when you treat a patient, treat them like a family member. I mean, of course, you'll have to cut the emotions away from that, but please do the same way that you would treat your parents when they are on the chair. My fifth tip would be always make sure that you have a relationship with dentists in and around your area. Most of us dentists think that they are competition, but you would not know that when sometimes you need something, that neighboring dentist would be of help. So always make sure you maintain a good relationship with dentists who are around you, and you can always exchange notes, ideas on how to tackle certain things in your daily private practice.
Thank you, sir. These are
My
really great and helpful tips for us.
Thank you. Thank you.